My name is Mickey Angeline, and what pride means to me is knowing that no matter how long it took me on my journey of self-reflection and recognizing who I really was, that the journey was worth it. I was 29 before I came out and realized I am lesbian, married to a man, having a child, living a straight life, living a life for someone else, before I realized that's not who I am. And even 15 plus years following that, to be comfortable in presenting myself the way I do today. I will be 53 this year, and this is what pride means to me.
It's paired with humility, looking back at queer history and seeing all of the strong ancestors that have done the work, that I have now rights because of what they have done, because the strong work that they have done, the rights that I take for granted. But pride is also knowing that we can do better, because there is a brand new generation of queer folk, and they're looking right at us and they're saying, what are you going to do to make my world better before I'm in charge of it? And I really hope that I can say I did everything that I had the power within me to make it easier and better for you to have essential human rights. And I think that's pride.
I think that pride is 100% the freedom to be your true, authentic self, regardless of what others think of you. My transition personally is what I'm prideful of. Becoming the person that I always saw in the mirror is my 100% goal. And loving everyone, no matter what stage they're in, whether that's not even coming out yet or fully through it all, just loving them unconditionally and understanding that not everybody's situation is the same. And I think pride is just not giving a shit about how others view you.
Beams, y'all, what up? It's Andrew Defy, a.k.a. the Gorilla Poet Laureate, a.k.a. the Hoodie God, a.k.a. Spittin' Quarantino, a.k.a. I wear my sunglasses at night indoors because my eyes are as sensitive as my heart is, y'all. And we are back with another episode of the internet's favorite community health live stream. Happy Pride Month, y'all. We've got another information-packed episode for you tonight with another brilliant guest. Tonight, we'll be joined by Sriram Shamasunder, an MD, who is also a co-founder and executive director of the HEAL Initiative. Dr. Shamasunder worked during the COVID-19 pandemic with the Navajo Nation and will be telling us more about that. And he just so happens to be a published poet. So we are going to bring you your entree of health news with a side of arts and culture tonight. We are talking California reopening. We are talking Delta variant. We are talking about how racism silences the most vulnerable communities at risk of health disparities. All that and a delve into the science of mRNA vaccines starts now. So California is reopened. Businesses are open at full capacity and maskless, but is the pandemic truly over? We've heard a lot about variants over the past year and a half, but the new Delta variant is raising a lot of concern among medical professionals who are worried especially about the unvaccinated portion of the country. Here's the latest from NBC News.
Tonight, the Delta variant is COVID's most serious threat, most dangerous strain so far, now contributing to a rise in infections in 8 states. Just as concerts sell out and summer crowds return to popular venues, the unvaccinated could prolong and exacerbate the pandemic.
It's starting to accelerate really quickly in the U.S. So last week, about 10% of the virus isolates for the Delta variant. Now it's up to 19%. So it seems to have pretty regular doubling.
While 65% of adults are at least partially vaccinated, the Delta variant has now been detected in nearly every state and is gaining a stronger foothold in regions highlighted here with low vaccination rates. In Missouri, the Delta variant has been found in wastewater, showing its vast community spread.
It's coming. You're at risk. You're a sitting duck if you're not vaccinated.
Across the country, the vaccine holdouts remain the young. Less than 40% are inoculated, compared to more than double that rate for seniors. But perhaps those most in jeopardy are children under 12 who can't yet get vaccinated.
When you're vaccinated, you serve as a wall, as a barrier to infection coming into your home, into your community. The more of us that can get vaccinated, the bigger of a wall we can build around our children who are still too young to get vaccinated. It's how we protect our kids.
Described as COVID on steroids, the Delta variant is fueling the next wave of cases here in the U.S. But experts say if enough people get vaccinated, there won't be a surge.
Obviously, the biggest health news in California is that we are reopened and back in business, y'all. As of last week, no more mask mandates. Well, a few still, but only until September. Here's ABC 7 in the Bay Area celebrating the reopening and giving us a little more clarification on who still needs to wear masks and where.
Looks the same here at BART. Masks are required on the train, so everyone here, today looks like yesterday. No big reopening story here. Masks are required on all of public transit, and BART officials say that is because the federal agency, the Transportation Security Administration, it's still requiring them, the TSA, in airports and on flights. BART says it isn't too worried about enforcement, saying they have been getting about 96% compliance on the train, so they will address the mask mandate that's still in place here from an educational perspective rather than an enforcement perspective. You also still need to wear masks at these locations, even if you're fully vaccinated. That's going to be schools, child care facilities, mass transit, of course, hospitals and healthcare facilities, indoor and outdoor mega events. That's going to be a parade, a live performance, a festival. Prisons and jails still want masks on, as do homeless shelters, and of course here on BART. And this is in place for everyone, vaccinated or not.
So one of the biggest fears we hear at Masked Up from our vaccine hesitant family is a fear of being shot up with the virus, as happens with a lot of traditional vaccines. The mRNA vaccines are a newer scientific development, however, and work in a very different way. So let's dig a little deeper and find out how the mRNA vaccines really work.
Vaccines have been used for centuries to fight off some of the world's deadliest viruses. While many vaccines have been made with a weakened version of the virus they are meant to protect us from, mRNA COVID-19 vaccines do not contain any copies of the COVID-19 virus. Instead, these vaccines are made with messenger RNA, or mRNA, which is a genetic material that our bodies use to deliver information to cells. Using mRNA in vaccines is helpful for multiple reasons. Since mRNA vaccines for COVID-19 do not contain a copy of the actual virus, they cannot infect you with COVID-19. The mRNA in the vaccine cannot enter the cell's nucleus where DNA is stored, so they cannot interact with or alter our DNA in any way. Additionally, the available mRNA COVID-19 vaccines have proven to be very effective vaccines at protecting against the virus. Here's how they work. Instead of exposing our immune systems to the COVID-19 virus itself, the mRNA in these vaccines carry information about the harmless spike proteins that surround the virus and teach our immune system how to recognize them. In a normal infection, the COVID-19 virus uses these spikes to gain access into our cells, where the virus can replicate and spread throughout the body. When given the vaccine, our cells use the mRNA to create harmless copies of the spike proteins instead of the whole virus. which our immune system then learns to recognize and attack. Antibodies attach to the spikes, preventing them from accessing any other cells and tagging them for destruction. Our immune system then remembers these spikes and can fight them off if they invade our body in the future. The mRNA injected through these vaccines also degrades after a short time, leaving behind nothing but a smarter, more prepared immune system. After receiving the vaccine, some people may experience effects such as sore arms, headaches, fatigue, and mild fevers for a short period. But this is a natural response and a sign that the immune system is working properly. So, just how effective are these vaccines? According to clinical trials involving over 70,000 patients worldwide, mRNA COVID-19 vaccines have been over 94% effective at preventing infections. Since approved by the FDA, millions of people have received mRNA COVID-19 vaccines, and ongoing evaluations have revealed no additional safety concerns. Getting vaccinated is the safest, most reliable way to prevent future infections, even for those people who have already been infected with COVID-19. While the vaccines will protect you from getting infected by COVID-19, it may still be possible for you to transfer the virus to other people. So it's important to continue carrying out practices that can keep others safe, such as washing hands, wearing masks, and social distancing. Make sure to check your state and federal guidelines for up-to-date information about vaccine distribution, and refer to your primary care physician about any concerns regarding your health. If you have further questions about COVID-19 vaccines, refer to trusted sources such as the CDC and WHO for more information.
Our guest tonight has been doing some incredible work as both an MD and as the ED of the HEAL Initiative. For tonight's Racism Crisis, we're going to give you a little clip of tonight's guest TED Talk called Whose Suffering Matters Less and Why. This is Dr. Sriram Shamasunder.
Tell them I stood side by side, the doctors and the dreamers, a poem in my left hand and a scalpel in my right. Tried and tried to funnel lilies and light from poems into the tip of my scalpel. Cut a slice of bread for the hungry. I wrote this poem at 19 as an idealistic undergrad at UC Berkeley. But the themes that run through it continue to shape my path to this day. What does it mean to be a doctor in this unequal world? A congressionally mandated study in 2002 showed unequal care between Blacks and whites across everything, from breast cancer to cardiac care to pain management. As health professionals, we want to do right by our patients. The vast majority of us mean well, but we struggle on behalf of what we know, who we identify with, who we love. If there were more narratives of Black women in the public sphere, would we have an easier time identifying with Black women? Would we be able to see ourselves in Black women? Would we push for a health system that ensures equal care for equal lives?
Hey, Dr. Shamasunder, how are you doing?
I'm doing great. Thanks for having me.
Absolutely. We are so excited about this. We just watched your TED Talk video. And in your TED Talk about who suffers matters less and why, you mentioned that deaths from treatable diseases start where narratives go unheard. First off, sheer poetry. How does a patient's quality of care change based on whether they are heard or unheard?
Yeah, I mean, I think to talk about that, one example that I could give, I was in Navajo Nation during the COVID surge in the beginning of the pandemic, and there was a patient that I was taking care of that was an elderly man, probably in his 70s, that had some lung effects due to uranium poisoning, and he only spoke the Navajo language, and I was in full PPE. I'm obviously not Navajo, and I'd come into his room. And I was with a nurse assistant, and I would say something, and then the nurse assistant would go in real close and whisper in his ear in Navajo, and you could just see his face kind of relax, and just the trust that came over him to engage with all these outside docs that are coming in, nurses that are working in Navajo Nation during the pandemic, and where are the Navajo providers that really understand the nuance, the context, speak the language to take care of that population, and so I think that that's where marginalized populations, Black populations, Indigenous populations, Latinx, like really benefit from people from their community that understand their community, that are from their backgrounds, that can understand, how do I talk to this patient about death and dying, because it's different based on whether you're in Oakland or whether you're in Navajo Nation. And so, in part of my program, we train health professionals, and a lot of the Navajo fellows, the doctors, have just an incredible amount of more nuance of talking to elders about death and dying, talking to parents about children who are sick, in ways that if you don't understand the context, you don't even know what you don't know. And I think that's what happens in the healthcare system, where, I'm from a certain background, and not to say that I always have to be from the background of my patients, but when there's, 0.009% of the medical doctor community that are Indigenous, we got a real problem there.
Absolutely. And I mean, what impact has the COVID-19 pandemic had on these unheard communities?
I mean, if you look at where COVID hit the hardest, and I was working in Navajo Nation, they had some of the highest rates per capita in the world, and they had 3 severe surges. And so you just think about which communities are most marginalized, and COVID preyed on those communities. And the U.S., whether it's the prison population, meat packers, basically people without voices in our health systems, and oftentimes live on the brink of disaster at baseline. All of a sudden, you throw in a global pandemic, and vulnerable patients and vulnerable people and populations suffer the most. And so we've seen that Indigenous populations, their rates of hospitalization and death are several fold that of white Americans, and the same is true for Black and Latinx patients, and so populations. And so you really see the breakdown of our fractured society and just the inequity that exists. And COVID really preyed on that inequity. And so it's been said many times that it made clear things that we already knew, and so it just unveiled even more starkly the inequities that exist in our health systems to begin with.
Absolutely. And to address this issue, because we're not problem oriented here, to address this issue related to health disparities within silenced populations, you started an incredible organization called the HEAL Initiative. Can you tell us a little about what the HEAL Initiative is working to ensure, like how are you working to ensure that these silenced communities become heard?
Yeah, one of the things that we always say is that, there's no such thing as people without a voice. It's just the preferentially unheard or silenced. And so how, this idea of like there's people, a voice for the voiceless. There are no voiceless. It's just people that are actually actively silenced. And so, the HEAL Initiative is a 2-year capacity building global health fellowship. And the goal is to really support and train frontline health professionals that make serving underserved communities a lifelong commitment, right? And so over the course of the last 7 years, we've had about 180 health professionals. Many of them are doctors, nurses, social workers, pharmacists. Half of them are U.S. doctors that are, finishing residency, done with their training. Another quarter are Navajo, and another quarter are from low and middle income countries. So you have this incredibly diverse community of Malawians and Haitians and Mexicans and, a pediatrician from Michigan and Navajo nurses all learning together of what does it mean to take care of and be an advocate for underserved, marginalized, resource denied patients, and really stand up with them and for them for the long term. And so oftentimes, health providers in Navajo Nation or rural Liberia are undersupported, overwhelmed, not connected to a community. And the HEAL Initiative is taking these people that are just tremendous leaders and really committed to health and healthcare of their communities and trying to take them to the next level to be, clinically more competent and gifted advocates, leaders. And so I think that's our mission, is to really how do we grow and support people for the long term to stay working with underserved. And I think one example, we work in Salinas, California, with a migrant farm worker community, and one of our fellows is this incredible nurse who came from Oaxaca, traveled at 2 years old, didn't speak Spanish or English. Her mom spoke an indigenous language, and was expected to be a migrant farm worker. She was pregnant when she was 15, and the nurse that took care of her told her, you should consider going to nursing school, and you should consider becoming a nurse. And now she's 37 years old, has a 23-year-old and 21-year-old, and she knows the migrant farm worker community, is from the migrant farm worker community, and is serving that community. And HEAL really takes someone like her and tries to bring them to the next level in terms of their advocacy skills, their leadership skills, and how they orient themselves to the work. And so that's our goal.
Such revolutionary work. And in addition to the HEAL Initiative, you recently co-authored an article about how the U.S. should learn from the generosity of Native American tribes, which have donated vaccines and PPE to patients in the U.S. and in India. What can the U.S. do to decrease global health disparities?
Yeah, I think that
the size says a lot.
There's a lot that needs to be done. I think, one thing that COVID has taught us that is so obvious is how interconnected our world is. And so, for example, like the standards for flying an airplane in Liberia are not different than flying the airplane over US airspace, right? And so how do we think about public health infrastructure around the world to get to a certain quality? Because, we're only as strong as our weakest link in the world in terms of public health infrastructure. And so what we saw in Liberia during Ebola, we work in Liberia and West Africa, a lot of these communities and countries have a lot of gifted health professionals, an amazing ministry, but their infrastructure, their workforce, a lot of the things that make a public health system strong is not as strong as it should be or could be. And so how does the global health community lean into that conversation and make COVID, the COVID moment needs to be a movement towards building health equity, towards like really raising the bar of what the floor is across the world for health infrastructure, because right now we're just so susceptible to, COVID is said in many circles to be like the starter pandemic, right? It's lethal, but it's not as lethal as some of the viruses. It's infectious, but it's not as infectious as some of the viruses we know and bacteria. And so we basically were knocked off our feet with the COVID pandemic, and that is the tip of the iceberg of what's possible out there. And unless we get our act together and raise the floor of health infrastructure around the world, we're all vulnerable.
And to just kind of build on that, a lot of wealthy countries have come under fire for their role in what folks are calling the vaccine apartheid. What can we do to combat vaccine apartheid?
I mean, the vaccine has to be a global public good. I think the insanity of what we're doing in the vaccine realm, the fact that we work with health workers all over the world, Mexico, Liberia, India, and they are those health workers that have put themselves at risk for the entire length of this pandemic are still not protected. And you have all the rich countries, getting close to opening up and coming back to normal. And then the rest of the world is, they're having their worst times ever in COVID. And so you can't have these, especially in a global pandemic. Like we're so normalized to this idea that you can have such deep inequity in the world and it can be normal. But in a global pandemic that we're just seeing with the Delta variant and all these variants coming out of different parts of the world, that we are very susceptible. So it's in our best interest, absolutely, to vaccinate the world. And, the TRIPS waiver, technology transfer, people much smarter than me have come out with, Oxfam and the public vaccine campaign have all come out with, several points that are required. And I think the TRIPS waiver and technology transfer and suspending the patents that the Biden administration have spoken about, but the EU Commission, and you just get the sense that the G7 are dragging their feet for something that needs urgency. And you can't replace technology transfer and manufacturing capacity with charity. And this idea that 500 million Pfizer vaccines or any amount is going to replace the capacity of that we know exists in India and South Africa and Vietnam to manufacture mRNA vaccines, to manufacture other vaccines. That's what we need, and we need it urgently. Like, the bread has been baked, and now instead of teaching all these other places, let's give you the recipe and you make your own bread. It's like we're going to distribute bread, and that's not the answer to the end of this pandemic. And so the end of this pandemic comes with the world being vaccinated, and we're just going too slow. And kind of business as usual, big pharma laying out the rules is not going to get us there.
Absolutely. So we're gonna pivot a little bit because I was so excited to have you on, not only to talk about all of the work that you're doing in the medical field, but also outside of it. Because in addition to being a physician and global health leader, you are also a published poet. So we want to hear just about the book. I mean, if you have a poem to share, feel free. But I know I'm kind of putting you on the spot. But can we know a little bit more about your poetry? Where can we find your poetry? What's your inspiration for your poetry? Tell me all about your poetry.
Yeah, thank you, Andrew. I know I've heard that you're a poet as well, so I'd be excited to read your work. I think, one of the things of being a witness to suffering and preventable death that all of us that are in this space, I think the COVID moment, a lot of the places that we work, there's so much unnecessary suffering, and the human experience is filled with suffering that is part and parcel of being a human, right? And then there's all this man-made, suffering that doesn't have to exist, and people dying from things that we know that they shouldn't be dying, suffering from things that we've solved, decades ago, even sometimes a century ago. And so from that vantage point, how do we tell stories? Because as we all know, as a poet yourself, like, people think in stories, people really understand things in stories. And so narrative matters, whether it's for telling an anecdote about a patient or building a movement towards health equity. And so I think that I actually when I was an undergrad, there's a Black woman poet named June Jordan, who is contemporary of Toni Morrison and Alice Walker, and just really Kate was a right-hand woman of Malcolm X. And so when I was 22, she was my teacher. In her last year, when she was dying of breast cancer, I spent a lot of time with her. And I was a first-year medical student, and I was like trying to navigate the medical world, and as a first-year medical student, and she was dying of breast cancer, trying to navigate the medical world as a patient. And so both of us found the medical world like unfathomable, and she would tell me stories about her life as an activist and a poet. And so she really shaped kind of this righteous anger about injustice that she lived, and also tenderness and a specificity of words. And so she'd be very clear about, when people in power talk about give an apology, often it's in the passive voice, and often it has a lot of language that obscures. And so when you're trying to say something that is powerful and clear and on behalf of marginalized people, you have to be crisp, you have to be concise, you have to be clear. And I think poetry does that so well, the best poems and the best poets. And so, yeah, I guess I just aspire to make sense of the work in the world through the written language for myself. And then, sometimes I will try to share it, but I wouldn't say I'm, I think I say I'm a poet with some humility, because I think it's for myself, and then I publish some. So yeah, I do have a poem that I can read a section of this poem that it's a longer piece that I'll read you a part of it. So
Please.
it says, in the spring, I spent 5 weeks in Navajo Nation, an indigenous community in the southwest of the United States, taking care of COVID patients. COVID is as common as desert cactus in Arizona, blooming like dandelions in an open field. That evening, like every other evening, I stood outside a patient room, an emergency room converted into several pods of plastic, cocoons that separate one patient from the next, and then them from us, all in the hopes of keeping the virus at bay. I methodically wear my PPE, Velcro gown clasp, secure the back, face shield, N95 on, cloth mask over, double glove, blue glove pulled over brown skin, no brown skin between gloves and gown, double check, zip up the tent, step in, zip closed behind me. He lies left side down, a young Navajo man, black hair braided down long past his lower back, right down the middle of his back, like an outer beautiful spine, stark against the bleached white sheets. Each thick hair knot, dense and strong as rope, like ancestors clasping hands over the other. Each knot, a closed knuckle, gathering like a prayer at the base of his skull. He has an oxygen mask on. I watch his eyes closely for signs of fear, and I watch his hands for signs of trembling or what they might reveal about a life before and up to this moment. I say, we will get through this, and then again louder, the first time for him, the second time for me. We will get through this. I leave the hospital at midnight. The next morning, a short coffee run in my rental car. My colleague calls to say that overnight, my patient emptied his lungs like a gas tank and puttered into the early morning in fumes, exhaustion. He was just intubated. He will be flown to Albuquerque or Phoenix, off indigenous land. This is the year of submission or surrender or survival. I can't decide which. When a patient is about to be discharged from the COVID unit, a call goes overhead from all over the hospital. Like a bird migration, we descend on the COVID unit from anywhere we might find ourselves in the hospital. All the health providers gather in line on either side of the hallway, like a sports team, waiting to high five their star player to come out of the tunnel onto the field. It is this moment a COVID survivor gets wheeled out the big doors into the sunlight, like exiting a dark tunnel into their family's arms. In those moments, I think this is the year of resilience, the year of I won't let you go. My Navajo friend tells me with confidence the Navajo people will walk in beauty once again. And then she repeats it again. We will walk in beauty once again. The first time for me, the second time I think she says it to convince herself.
That was beautiful. That was beautiful, Doc. Thank you so much for that. I might be getting a little weepy behind these sunglasses. Okay. Yeah, that was beautiful. I love the we'll get through this. The first time for them, the second time for me. Like, beautiful. All right, let me gather myself real quick, and because I got one last question, and it is the question that I ask everyone who comes on this show, because I am an expert joy hunter, and I feel like a lot of you all are too. Where are you finding your joy today?
I think the easiest thing comes to mind is like I have two little kids, 5 and 2, and just like rolling around, laughing with them. They eating popsicles, hanging out, going on walks. I think that the fresh eyes of looking at just the ordinary. I think that's what we're all doing in coming back in, as hopefully COVID fades a little bit, coming back into the world is to have gratitude for all the ordinary pieces. And there's nothing like kids to find that, and really like hone that muscle for adults. And so I'm definitely joyful of that. And then, I think one of the best gifts in this work is to have a community of noble friends that are standing together, working, struggling, whether the media is there or not. And so to be able to call up friends in Malawi or Navajo Nation or work alongside people that are really deeply committed to health justice, to equity, to love, is just an act of resilience and joy that I find myself leaning on over and over again. And so I think there's nothing better than to have a community of noble friends that are committed to something beautiful together, and the struggle. And so that's joyful as well.
Another 24-karat gold answer. Man, just thank you so much, Dr. Shamasunder, for being here and for your words, for your energy, for all that you are and all that you've been doing out here. Just huge gratitude from all of us. And we'll have to have you back so we can get a little more poetry talk going on over here.
Thanks, Andrew. I got to hear your poetry next.
And that brings us to the end of another episode of Masked Up. We want to thank the half of the internet that tunes in every week. We couldn't do it without y'all. I'm Andrew Defy. As always, shout out and big thanks to Netta, Allison, and the rest of the Protect Us crew. Like Mazi said, health is wealth, and I need my bag. Remember, health doesn't come from a pharmacy, y'all. Till next time.